Well, thank you for joining us today on a Friday afternoon. We're going to be talking about healthcare in retirement. It's a really important topic because it is a pretty large expense that you could incur while you're retired, and we have to plan for it. We have to plan for it before we retire and after we retire. So we're comfortable with our monthly annual costs that are going into this bucket. So today we're going to talk about planning for pre and post retirement healthcare costs. And we're really going to dig into Medicare, learn the ABCs of Medicare, the mistakes that some people make so you can avoid them, and then go into income and how income can actually change your Medicare premiums. And we're going to end with long-term care, talking about that bucket. So speaking of buckets, when you think of your healthcare costs in retirement, I want you to think about them in two distinct buckets. Your one bucket is your traditional healthcare costs. In this bucket, we want to think of in annual terms, in monthly terms, like what's my monthly cost going to be? What am I going to pay next year? Just to break it down, your doctors, your prescriptions, a lot of them are covered. That's covered by your Medicare plan. But when we're talking about some other costs like dental, vision, and hearing aids, things like that typically aren't covered by a lot of Medicare plans. So we really have to understand what we're going to have to pay out of pocket to make sure we're comfortable with that and we budgeted properly. Now, a lot of people think that Medicare is free, and that's far from the truth. We're going to dig into that. On the other side of the equation, in our other bucket, that's long-term care, this is not covered by Medicare, and we think of it separately in another bucket because some people will not need long-term care expenses at all. Maybe you have family that's going to take care of you, but a lot of people will need money in this bucket because maybe they're going to have to go into a retirement home. And people make the false assumption that that's going to be free. The government's going to pay for our long-term care. What they're thinking of is Medicaid. To qualify for Medicaid, you have to have very low assets and very low income. So you really have to spend down everything. So a lot of us are going to have to fund our long-term care, and we're going to have to think about how we're going to cover that bucket. So we're going to dive into Medicare eligibility. So you're first eligible for Medicare at age 65. Some people that are disabled, maybe you're on Social Security disability, you can be eligible for Medicare earlier than that, but most of America, we have to wait until age 65, and it's the reason why a lot of us will delay retiring until that date. So as you're turning 65, we want to think about enrolling for Medicare 3 months before our 65th birthday. Your initial enrollment period, what that means is you have a 7-month window that is around your 65th birthday. So you can start enrolling 3 months before your 65th birthday, and then your coverage starts the first day of your birthday month. But then you also have 3 months after your birthday to sign up, and your coverage will just be a little bit delayed because you're signing up after your birthday. But in that initial enrollment window, as long as you sign up, you won't get penalized. So now we're going to talk about if you'll get penalized and if you won't get penalized. So there's some people that are eligible to delay signing up for Medicare. So as you're turning age 65, you look at your situation, you say, okay, am I going to retire? And am I going to lose my health coverage? Okay, you have to sign up for Medicare at 65 because if you sign up later, you're going to be penalized. Now there's people that they're working for a small employer with 20 employees or less. In that situation, let's say you work for the small employer or your spouse works for that small employer and you're on their insurance plan. That insurance is not Medicare delay eligible. Medicare becomes your primary insurance, so you want to sign up at age 65. Now, the other bucket, the people that work for larger employers. So you work for an employer that's over 20 employees. You have some options. You can delay signing up for Medicare because Medicare does come with costs. Maybe you love your health plan at work. You just want to be on that as long as possible. You can delay signing up for Medicare, and you can sign up later when you decide to retire in what's called a special enrollment period. You will have 8 months from when you lose your health coverage, so from your retirement date. Most people, of course, sign up so their coverage starts right away, but they give you that special enrollment period so you won't get penalized, but you will have to prove to the Social Security Administration that you had eligible health insurance coverage to be able to delay signing up for Medicare. So I encourage everyone, you're in the year, you're turning 65, just call your benefits department, somebody that works with your health benefits, and just ask them the question, hey, I'm turning 65 this year. Can I delay signing up for Medicare, or can I stay on this plan? See what they say. Rules are 20 employees or less, you sign up for Medicare. The other side of the equation, you can delay. And I'll just give you a quick example to bring it home. My father, he worked for a very small local government. So there's 16 employees. He has a road crew, a secretary, very small local municipality. When he was turning age 65, I told him, hey, you got to sign up for Medicare. And he said, no, I love my United Healthcare. It's a great plan. It's a government plan. It's amazing. And I'm like, well, I think your local municipality fits under those Medicare rules that it's small. Well, he reached out and he found out that's true. So he had to go on Medicare. My mother, who is younger, she could stay on the health plan because she wasn't 65 yet, but his employer subsidizes his Medicare premium. So a lot of these smaller employers, because you're forced to go on it, they will pay for your Medicare just as a benefit. So just something to keep in mind and to ask about. Now, some of us want to retire early. We don't want to wait until age 65. But you're going to have to bridge the gap to Medicare and find that health coverage to get you to age 65. Some of us are very fortunate to have retiree health benefits, but that is becoming less and less popular. Most people don't have these benefits. Like a few people, typically government workers, will have them. So we move on to, okay, my spouse's health plan. Maybe your spouse is still working and you can jump on that health plan. Now, COBRA, this is for a short-term situation. So let's say you're age 64 and you cannot work another year. You are tired. You can go and continue your current coverage at work and have exactly the same coverage that you have to bridge the gap to age 65. The downside, typically your employer won't subsidize their part, so you'll probably have to pay double what you're used to paying to get that COBRA continuation. It typically lasts for about 18 months. So it's for a shorter period of time. That brings us to the most popular option to bridge the gap to Medicare, the Affordable Care Act, marketplace plans. You can go out to healthcare.gov, and that's going to give you all the specifics on all the plans. Just know that there's a ton of different options of plans with different premiums, different deductibles. But as you age and you get older, they become a little bit more expensive. But the good news is legislation was just passed in August that is going to extend for another 3 years the large state subsidies that are paying towards your premiums for these Affordable Care Act plans. So some people that have moderate to lower incomes will get very large subsidies paid for the next couple years. So you can always work with your advisor, go to healthcare.gov to price out these plans if that is your situation you're looking to do. So now we're going to go into the ABCs of Medicare, and we're going to start with Part A. Now, Part A is the only part of Medicare that is free. So if you have worked 10 years in your life, or your spouse has worked 10 years, then you will get Part A for free. And they call it premium free Part A a lot of the time. Once you enroll in your Social Security benefits, you will automatically get Part A. People that take their Social Security benefits early, let's say you take your benefits at age 62, those are the only people that get automatically enrolled in Medicare at age 65. They will send you a Medicare card in the mail. You're going to get enrolled. If you don't want to be enrolled, you actually have to send the card back and disenroll. Now, for other people, a lot of people wait until full retirement age to take their benefits. So they have to actually take action and sign up at age 65 if you want Medicare. And some people that work for that larger employer, they will just sign up for Part A because it's free and they're getting, coverage for hospital care. So Part A covers you for your inpatient hospital care, 100 days in a skilled nursing facility. There's one reason why you wouldn't sign up for Part A, and that is if you are contributing to a health savings account. Let's say you work for Vanguard. We have a high deductible health plan with a health savings account. If I went and signed up for Part A, I could no longer contribute to my HSA. So just one reason why you wouldn't. Now for Part B, this part does come with a cost. This in 2022, it's $170.10 per month per person. It automatically comes out of your Social Security check. So some people get surprised. They say, my Social Security check is lower than I thought it would be. It's because Part B premium is coming out of that. Now, Part B is the part that some people will delay, but let's say, and this has really happened many, many times, let's say you're really, really healthy, you're age 65, you retire, and you look and you say, I don't want to pay $170 a month. Like I didn't go to the doctor once last year, so I'm just going to wait and I'm not going to sign up for Medicare. What happens is every year that passes, you will get a 10% penalty that is tacked on to your Part B premium for the rest of your life, and it cannot be reversed. So this is a real live situation. There was a man, he was very healthy. He never had any problems. He, at age 70, started to have like liver failure. He needed to get like a lot of treatments. So he decided, now's the time I'm going to sign up for Medicare. When he signed up, that was 5 years he went without credible coverage. So he had a 50% penalty that is tacked on to his Part B premium for life. That's an extra $85 a month he's paying more than everybody else. So avoid that mistake. Make sure you sign up when you need to sign up at age 65, or if you delay, make sure your insurance is delay eligible. Now, Part A and Part B together are referred to as original Medicare. So you'll hear a lot of Medicare people talk and say, oh, original Medicare. That's what they're talking about, the Part A and Part B together. Now, some people will stop right there and say, all right, that's what I'm getting for Medicare, and I'm going to call it a day. Part D, D stands for drug, your prescription drugs. These, although they are optional, some of these plans are very inexpensive. You can get a $5 a month premium for a Part D plan. If you opt out and you do not sign up for a Part D plan at age 65, Or if you're delaying, if you didn't have a prescription drug plan tied to your health plan, you sign up later at age 75, this comes with a penalty too. It's not as steep as Part B. It's a 1% penalty off the average base rate, but still it adds up to another penalty that you'll have for the rest of your life, although not as severe as Part B. So Part D, entirely dependent on what drugs do you take, what pharmacies do you go to, and there is a plan that is good for you. Now, Part A and Part B, original Medicare, this is going to cover 80% of your medical costs. But now you have a 20% gap. You have co-insurance you have to pay. You go to the doctor, you pay 20% out of pocket. You get a procedure done, 20% out of pocket. This has no out-of-pocket maximum. So what people do is they cover that 20% gap with a Medigap supplement plan. Now, Medigap, they are offered by private insurers. So companies that you have heard of and companies that you haven't heard of. It's like Aetna, Humana Gold, Accenture, United Healthcare, all these healthcare companies. So you can sign up for them. They are entirely optional. To take this a step further with Medigap plans, everything is state specific. It depends on where you live. So not every state will offer all of these, but many states will offer most of them. And just to make this a little bit more aggravating, in 2020, the government closed Plan F and Plan C. So C and F are currently closed to new enrollees. If you were age 65 prior to the year 2020, you still may be able to get them. But if you were not age 65 prior to 2020, you cannot get I call it the Fantastic plan, F for Fantastic. It's the most popular Medigap plan, but the government has closed that. So the government mandates all of these benefits, and you can see that they cover different parts of the gap of out-of-pocket costs that you would pay. So the one that exists today for new enrollees that covers the most benefits is Plan G. I call that the great plan, the gold plan. It covers every out-of-pocket cost except for Part B deductible. And what that means is you would pay $233 before your benefits kick in, and then all of your out-of-pocket costs will be covered. So very comprehensive plan. Every doctor will take your insurance across the United States. All these Medigap plans are very flexible, widely accepted everywhere. The next most popular one is Plan N, the really nice plan. This one covers a lot of benefits, except for you might pay a few $20 copays for certain doctors. And then there's something called a Part B excess charge that they will not cover. And the reason why I don't think this is a big deal, there are maybe 5 to 10% of the doctors in America that they don't agree with the Medicare rates. So Medicare says, this is what you're getting paid, doctor, and they think they're worth more than that. So they can charge an extra 15% to go to that doctor. So if you check and all your doctors that you typically go to do not charge Part B excess charges, you could go with a Plan N because this monthly premium could be a little bit lower than G. So to be honest, the other Medigap plans, they get very low usage, like 1% of the population signs up for them. So G and N most likely are the ones you're going to look at the most and price out. So one thing I want to caution you with Medigap plan, because this is a mistake I see a lot of clients make. The first time you sign up for your Medicare Part B, your doctor's visits, you get a free look to sign up for Medigap, meaning they will not ask any health questions. So if you have pre-existing conditions, doesn't matter the first time. So when my father, he signed up for Medicare a while back, he had 2 cancers, high blood pressure, high cholesterol. So a lot of health issues that insurers would not like to see. He signed up for Plan F. Hey, I'm going to go to the hospital, nothing out of pocket. You literally are totally covered. You have nothing to worry about. He also has 2 houses, one in Florida, one in Pennsylvania. He needs a flexible plan that he can go wherever he wants and not have to worry about it. So if he decided he had sticker shock and he didn't want to pay the monthly premium for this F plan, and he said, you know what, I'm retired, I'm going to research this for the next year and figure out what I want to sign up for. If he had done that and signed up that following year, they would have denied him coverage and he would never be able to get into a Medigap plan again. So this is state specific, but that's the rules for most states in the United States. Is that first time you sign up could be the most important time. There are a couple states that give you this guaranteed issue. They give you a free look maybe once a year around your birthday. There's a handful of states that do that, like California is one of them. But with those states, typically you can go down in benefits, you can't go up. So if you signed up for a cheaper Medigap A, you could get that free medical underwriting, and they won't look that first time, and then it's the birthday rule. They'll look and say, okay, you have a free look, but you can go down in benefits. You can't get the G. So I just stress, the first time you sign up, really think about hard what you want long-term, because what they're trying to avoid is only sick people signing up, because health insurance doesn't work if only the sick people sign up. So Medigap, if you get sick later on and you try to sign up for Medigap, you might be denied coverage. So just keep that in mind. Now, the last part of Medicare, and the last part called Part C, this is also called Medicare Advantage. That's the same thing. This is the one that you're going to get a ton of mailers. Like, you'll get mailers as you're turning age 65, and then every year after that. The reason why you're getting mailers is so these are fully bundled plans. They're offered by the same private insurers that offer the Medigap plans. They bundle together your Parts A and your Parts B. They're going to cover all those costs. A lot of them have a drug prescription plan all bundled together. And then some of them have other perks to incent you to sign up for them. A gym membership, dental benefits. So they all are different. Some of them will even market, hey, we're premium free. You pay no monthly premium. So the reason why they're marketing so heavily is because Medicare pays them for each person that signs up for their plan. So because they're covering Part A and Part B benefits, they get, let's say, $10,000 a person to cover you for Medicare. And typically the insurance companies make out. They will make money because they just collect that and they don't pay that much out in benefits. So that's why all the advertisements. But a third of the population signs up for Part C Medicare Advantage plans because they are more affordable. The premiums tend to be lower, but they are less flexible. You are going to have to do homework, and you also have to be comfortable with the network. You have to go to doctors in the network. Let's say you get a rare cancer that only the Mayo Clinic is treating. You'll have to pay 100% out of pocket to go to the Mayo Clinic. You must stay in the network. If you need a procedure done, you need pre-approvals, pre-authorizations. So some people on these Medicare Advantage plans will complain about, I want the procedure done, I had to wait 6 months. So you're traveling and you break an ankle and like have to go to a doctor and it's out of network, you might have to pay out of pocket. So this requires a lot of homework to make sure you're comfortable with the network and your out-of-pocket costs if something happens, but nothing wrong with it. It's just what you want out of your medical insurance. Do I want nobody to tell me what to do? I'm willing to pay up a little bit for worst case scenario protection, or do I want a lower monthly cost and I'm willing to do a little bit of homework? Now, we're entering Medicare's open enrollment period, October 15th until December 7th of each year. So what does that mean? This is the one time a year that you as a Medicare enrollee can shop your Part D plans. You're going to get an annual notice of change every September, and it's going to tell you changes that are happening in your Part D plan. And if you're signed up for Medicare Advantage, it's going to tell you the changes in your Medicare Advantage plan. You want to shop it because sometimes drugs are dropped from the formulary and you're not going to get that drug covered next year. And that's scary because it could be expensive. So we want to shop Part D every year. You'll probably save a couple $100. And also Part C, you want to check, are my doctors still in the network? Are my drugs still covered? You want to make sure you're comfortable with the premiums with that plan. If you do nothing, which many people do, your current plan will roll over into the next year and you are locked into it until the next open enrollment in October. Now, Medigap plans, you can shop them whenever you want throughout the year, but there will be full medical underwriting. And they're going to want to ask you a bunch of health questions, just like similar to like you're applying for a life insurance policy, and they will price you accordingly. Now, to bring this all together and put it all together for total cost. So we talked about Part A being free. Part B, nobody can escape this $2,000 a year that you're going to have to pay. Even Medicare Advantage, you still have to pay Part B. So Part D, your drug prescription plan, this is a national average. Some people that are diabetic will pay more. It really depends on what drugs do you take, what pharmacies do you go to, and there's a plan that's right for you. This Inflation Reduction Act that was just passed in August is going to affect Part D in a good way. Come 2025, they are limiting your out-of-pocket cost for Part D for like your deductible and your out-of-pocket drug spending at $2,000. The problem is that's not going to happen until 2025. So we have homework and we really have to pay attention for the next couple years. Now, Medigap, that's the Plan G. This is the great plan, the gold plan, covers you for like all of your out-of-pocket expenses. You can see there's a wide range of wide range of expenses. And the reason for that is this is national. It depends where you live. Some of us live in a more expensive area. We pay a little more. All the insurance providers, although they give you the same benefits, they will price you different. So you want to check the pricing. And it also, if you're doing the medical underwriting, your health could bump up the premiums. So my parents pay around for a Plan F, which is a little more expensive than Plan G. I'm in Pennsylvania. They pay around $250 a month to give you like a ballpark estimate. And that's just for that Plan G, but it's a great plan. So it is very likely that you're going to be spending $10,000 to $12,000 per couple on your healthcare expenses in retirement if you do a fully comprehensive plan. But work with your advisor to see what's best for you, what you can afford in your budget. And now this brings us to like one of the most maddening parts of Medicare is how your income plays into this. So we just talked about Part B and Part D, your doctors and your drugs. There is something called IRMA, Medicare's Income Related Monthly Adjustment Amount. Now, the way that this works is they have these brackets set up. If you are single and you are a penny over 91,000, or you are married filing jointly and you are a penny over 182,000, what's showing on your tax return, you start to have to pay more for Medicare. And let me tell you what's included in what we call modified adjusted gross income. So think of, I have a pension. Maybe you have Social Security income. A lot of people, 85% of that is taxable. It's going to hit this equation. Maybe you have an investment portfolio that's taxable, that you have capital gains, interest, dividends that are being spit into that. That's all going in here. Maybe you have muni bonds or regular bonds in a taxable account. Muni bonds and regular bonds, the interest, that goes into this equation. Let's say you're age 72 and you're taking required minimum distributions. Maybe you have an old inherited IRA that you have an RMD. Maybe it's your own required minimum distribution. That's going to be included in here. Now, the things you might not be thinking of. Let's say you have a large traditional IRA and you decide you want to buy a vacation house and you saved the money in there. So you take $250,000 out of your traditional IRA. Guess what? You just increased your Medicare premium for a year. And the way this works is in 2022, they're going to look every year, they're going to look at your tax return from 2 years ago. So in 2022, they're looking at your 2020 tax return to determine this. So it's delayed because people file their taxes late. So your 2023 Medicare premium, they're going to be looking at your 2021 tax return. So a lot of people did big Roth conversions back in 2020 when the market was low. A Roth conversion hits your tax return and could inflate your Medicare premiums for a year. And you can see how high it can get. This is monthly per person costs. So just something to work with your financial advisor about. If you have a large purchase you're going to make, or maybe you have a sick aunt that is going to be leaving you an inheritance. In today's world, if we get an inheritance from somebody that's not our spouse, we have to take that inheritance in a 10-year period. So there is a lot that can be affected, your tax situation and your Medicare premiums. So it's important to work with your advisor to help work out how you're going to receive your money over what time period. It can get pretty complex. One more thing I want to note here on IRMA. Let's say you are a high earner right now, and let's just make it simple. We'll say you're single and you make $180,000. That's your salary plus your muni bond interest. So 180,000, you're almost in the top bracket. But now you retired, and they're looking at your tax return from 2 years ago when you were making 180,000, but you're in retirement now. You have all Roth assets that's not hitting your tax return. You've planned to have lower income in retirement. You now have 75,000. So you should be in this lower bracket. There is an appeals process where you can appeal the decision to assess you IRMA, and they will lower your Medicare premium. So keep that in mind. If you think about your situation and you say, 2 years ago, I had a life-changing event, like maybe I retired, my spouse died, and I lost their income. There was some kind of event over the last 2 years that caused me to have less income today than I had 2 years ago. Make sure to talk to your advisor about that and appeal that, because otherwise you'll be paying too much for 2 years until your tax returns catch up to you. So now to wrap up with long-term care. Long-term care costs are not covered by Medicare. So Medicare will cover you for 100 days in a skilled nursing facility. If you don't have one of those Medigap plans, there will be some additional out-of-pocket costs that you'll have to pay once you're in there for, a certain number of days. But some of us will need some level of long-term care in our life. And women tend to need it a little bit more than men. And really, I think it's just a math equation because women tend to live a little bit longer. Women tend to be in facilities for longer periods of time. So if you have a history of Alzheimer's, dementia running in your family where you might need to be in a home for a little longer, just think about that, because a lot of people need at least 2 years of paid long-term care. And also the risk here is that you're in this 18% of retirees are going to have to pay more than $250,000 for that long-term care bucket that is not covered by Medicare. So this is something really important. If you haven't spoken to your advisor about it yet, how am I going to plan for that potential expense that half of the retirees out there have $0? Maybe their family takes care of them. So it's, half of the people are going to have no expenses, but there is a risk that you're going to have to shell out a lot of money. So you can save for it on your own. There's a lot of options with long-term care insurance. There's a lot of life insurance types of products that have long-term care riders. Your advisor will let you know what's best for your situation and how to insure against this potential event in your future. So I'm going to wrap up with just encouraging you, review your income, your insurance, your health care with your advisor each year. We want to know, is there anything happening? Is there an income event coming in the next year or two that we should plan for so we don't hike up our Medicare premiums when we don't need to? We want to price our Medicare Advantage, our Part D plans every year during open enrollment, October 15th until December 7th. We want to make sure we sign up for Medicare on time to avoid penalties. Make sure you have healthcare directives in place. Like, think about setting them up so your wishes are granted if you're in a bad situation with your health. And then also, if you're younger, you still have some working years left, we want to discuss how we're going to save for these costs, because you can save and fully fund your healthcare costs with investment vehicles like health savings accounts. And we can save for our long-term care expenses. So definitely important things to work with your financial advisor on.